As temperatures begin to drop, Duluth's Warming Center is open for those who need shelter. The Warming Center is located at the Duluth Housing and Redevelopment Authority's Rainbow Center. Coordinator of the Warming Center, Joel Kilgore, says going forward, they could see anywhere from 50 to 60 guests at the Warming Center on a given night. He says an average of 200 to 250 Duluthians are sleeping outside in cars or in places not meant for human habitation. Kilgore says the Warming Center is much needed to protect people in Minnesota's brutal winters, but stresses it is not a solution.
Ultimately, what we need is more than emergency stopgaps like this when it gets really, really cold. The solution is going to come with long-term permanent housing for everyone in our community. And until we achieve that, this is just a Band-Aid. What would it look like to have a Duluth where everyone has a place to call home? Because ultimately that's the most right and just thing and the most cost-effective thing and life-saving. The pandemic has complicated life for a lot of people. There's less access to service providers that they rely on. A lot of things, including waitlists for housing, have slowed down.
The Warming Center is made possible with a partnership between CHUM, St. Louis County, the City of Duluth, the Housing and Redevelopment Authority, and Loaves and Fishes. The DTA is providing free rides to and from the center when it's open. And a reminder, CHUM's drop-in warming center is also an option for those needing a safe spot away from the dangerous cold. Well, joining us now with more on what's being done to help the homeless is Gena Bossert, the Behavioral Health Director with St. Louis County Health and Human Services. And Gena, welcome. Thanks for being here.
Thank you, Julie.
What kind of support services does the county provide for the homeless?
So we have a whole area at the county. Part of behavioral health is housing and homelessness. And so really what we're doing at the county is we're applying for grants and support, both from the state and the federal government, to help with housing and rapid rehousing of people who are homeless and supports for people.
Mm-hmm. How has COVID impacted the county's ability to both reach and to serve the homeless population?
COVID's really affected everything we do. In the past, the homeless or the warming centers, right, were smaller areas. We had a couple last year, one in West Duluth and one at the Gloria Day Church. But this year we really have to look at the space because we need to have enough space so that people can have social distancing and that there's less possibility of transmission of COVID if somebody is not feeling well.
Mm-hmm. As someone who has lived in Duluth for a long time, I know what the winters are like, and that has to be really deadly for people who are living on the streets. What are some of the health implications of the winter that you don't really have to deal with during the summer months?
Well, there's always, the elements, so frostbite and those kinds of issues are terrible over the winter. This year, the Lake Superior Community Health Center is going to provide some medical care every other week at the Warming Center so that things that pop up and that maybe people aren't inclined to go see a medical provider, that there would be some access to medical things like frostbite, like wound care, that kind of thing.
Mm-hmm. How do you get the message out to people that these warming centers are available to them and that other services are available, because they're really hard to reach population?
Well, thankfully our partners like CHUM and Loaves and Fishes get the word out to people, and it seems like now that we've had the warming centers, this would be the third winter that we've had warming centers, that the word is kind of out and that people do know that warming centers are happening. And Joel also does a great job of communicating the when the warming center is going to be open. We have a temperature threshold, so 32 degrees is the temperature threshold, and so he does a really great job of letting the community know that the warming center is going to be open.
Mm-hmm. We hear a lot about homeless people living in urban areas like Duluth, but what about the more rural parts of the county? Is this something that's really central to Duluth, or do other parts of the county experience it as well?
Yes, other parts of the county experience it as well. It's probably just not as noticeable in Duluth. you know, I think the numbers are higher, and we tend to see more homeless people. But in the northern part of our county, we also have people experiencing homelessness. Our provider in the north is AEOA, and there's a homeless shelter in Virginia, and they provide services to people throughout the northern part of the county. It's more complicated because there are so many communities, and it's a little bit harder when it's so spread out, but there is homelessness throughout St. Louis County.
Mm-hmm. Talk a little bit about the mental health impact of homelessness.
Many people who are homeless have experienced some kind of trauma in their past, and so that really affects their abilities to, well, their use of substances. It can affect that, and then also, you know, mental health. Trauma does affect mental health also, and when people are experiencing homelessness, their probably first thought is not about seeking services for mental health. It's about being warm, it's about having food, it's about clothing, it's, you know, all of those kinds of things. So I think when people are homeless, those aspects of their life are sort of put on hold because they're worried about the basic needs.
Mm-hmm. Joel talked a little bit in that pre-recorded interview about how he doesn't feel that the warming centers are really the final solution, but they do help the situation in a crisis. What are some of the things that you think need to be done to really get at those root causes of homelessness in our area beyond just putting a Band-Aid on it?
So yeah, Joel's absolutely right. The warming centers are just a Band-Aid during the winter. Really what we need are a continuum of services for people. So we need more affordable housing, and we need more permanent long-term housing for people. An example would be up towards the mall. There's a new development by Center City Housing. It's called Birchwood. So it's up near where Birch Tree, the Crisis Stabilization Center, is. And it's a brand new development. They started construction. It will be done in the fall of 2021. And that's going to be 30 units of one-bedroom apartments. And so that building will also have supportive services so that people who have a hard time maintaining housing will have support right there in the building that can help them be stable and have a great place to live.
We're kind of in the middle of the holiday season. Does this time of year, with the holidays, make it more challenging for those who are homeless?
I think it does, just like it does for all of the rest of us. I think the holidays can be a very stressful time, and people who are homeless, it can be even harder. I think COVID has been really hard for people too. I think people are afraid to sometimes come to the shelters because of the congregate nature of it, and staying out in the winter elements is very dangerous.
All right. Well, Gena Bossert, Behavioral Health Director with St. Louis County Health and Human Services, thank you so much for coming in. We appreciate what you're doing and hearing about it.
Thank you very much.
Thanks.